Britain reports its first known death from the Omicron variant, and the government opens booster shots to all adults, acknowledging 2 doses is not enough. This as the United States nears 800,000 COVID-19 deaths, with a surge of new infections in the northeast and midwest of the country. Hello, I'm Anand Naidu, and this is The Heat. Scientists now say the COVID-19 Omicron variant, first detected in South Africa and Botswana, has now been discovered in more than 65 countries. The British Prime Minister Boris Johnson announced the first known death from the Omicron variant on Monday and warned a tidal wave of infections is expected to sweep the country. The British government is accelerating its vaccine booster program aimed at getting all eligible adults a booster shot by the end of the year. The United States has close to 800,000 deaths and 50 million confirmed cases. Omicron has now been detected in at least 30 states. Dr. Anthony Fauci, the U.S. top infectious diseases expert, explains why the new COVID-19 variant is so worrisome.
The thing that's important is that it appears to be able to evade some of the immune protection of things like monoclonal antibodies, convalescent plasma, and the antibodies that are induced by vaccines. That's the sobering news. The somewhat encouraging news is that preliminary data show that when you get a booster, for example, a 3rd shot of an mRNA, it raises the level of protection high enough that it then does do well against the Omicron, which is, again, another reason to encourage people who are not vaccinated to get vaccinated, but particularly those who are vaccinated to get boosted, because that diminution in protection seems to go way back up again.
For more now on how countries are responding to the Omicron variant, let's bring in our panel. Joining us from Virginia is Dr. Kate Tulenko. She's the CEO of Corvus Health, a global health firm. Here in Washington, D.C., Joseph Williams is a former senior news editor with U.S. News and World Report. And from the United Kingdom, Dr. Chris Smith is a consulting clinical virologist at the University of Cambridge and the co-host of the Naked Scientists podcast. Thanks to all of you for being with us. Chris Smith, let me start with you. The British Prime Minister Boris Johnson says that the country is facing what he called a COVID emergency. In fact, the country the threat level in the country has been raised to 4, 5 being the highest level. Let's listen to what Mr. Johnson had to say.
No one should be in any doubt. There is a tidal wave of Omicron coming, and I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need. But the good news is that our scientists are confident that with a 3rd dose, a booster dose, we can all bring our level of protection back up.
So, Chris, what is your assessment of the threat that is posed by the Omicron variant in the United Kingdom?
Well, we're taking our lead really from countries like South Africa, the country that first detected the new variant about a month ago, and where they now have at least a month of follow-up. And not just of case diagnosis and the trajectory of spread, and that's been pretty radical. It started with just a handful of cases, and the whole country was only measuring a few hundred cases of coronavirus in total, all variants. And then suddenly this came along, and it shot up to 15,000 cases per day, the vast majority of them this new variant. Now the question would be, well, would that translate into significant numbers of very ill people in hospital? There has been an uptick in admissions to hospital in Southern Africa, but not on the scale that we've seen with other variants, which kind of gave us some reassurance that perhaps this wouldn't be as severe. Cases, yes, consequences, less so. But one is always very cautious about extrapolating what happens in one country with a very different demographic profile, different vaccination rates, etc., to another country like the UK, for example. And so that is why politicians are sounding cautionary notes, because the evidence we have about this variant is that it does appear to swerve around the protection conferred by either previous infection and vaccination, but not completely. And what we haven't got is that crucial data, which is, well, if you are vaccinated, what about the risk of severe disease? Because it may well be, yes, you can catch this thing. We knew you could catch Delta. But what we don't know yet is, does it defend, if you've been vaccinated, against severe disease? And so just to be really cautious, there's this strong push to urge everyone to get vaccinated if they've not been at all, and boosted if they have been vaccinated, because what we can say is that if you raise the level of immune protection with those various measures, you can outcompete the ability of the virus to swerve around your immune system, probably about 75% of the time, which is a reassuring place to be.
Right, and as far as vaccinations are concerned, Chris, you know, though we heard the Prime Minister Boris Johnson there urging people to get that booster shot. Now, here in the United States, the authorities here are facing a lot of vaccine resistance, vaccine skepticism. But are you encouraged by the fact that there are long lines of people waiting to get that booster shot, well, in London, for instance?
Well, both encouraged and discouraged, because people are being told Boris Johnson gave a briefing or an announcement on national television last night. You just played a clip of it. And he said that there was a risk that the National Health Service would be overwhelmed. Well, today it was overwhelmed by people not with coronavirus infection, but trying to get their booster against coronavirus infection. There were very long queues, and the NHS Booking Your Booster website crashed. Thankfully, I think that's now back under control. But certainly people are motivated to try and do something about it. But I am concerned that some of the notes that are being sounded are verging on the hysterical. Really, we don't have data to support the kind of reaction that we're seeing at the moment. We know that there are a lot of cases potentially brewing, but we don't have evidence there are going to be the sorts of dramatic consequences. And one is concerned that some element of scare tactics is being used to drive the accumulation of those very long lines outside COVID booster stations.
Kate Tulenko here in the United States, you know, as we reported just a moment ago, the number of deaths is closing in on 800,000, and we could see that this week. We're now beginning to see sharp rises in the number of cases, in a surge rather, in the northeast and the Midwest of the country. What's behind these increases?
In the U.S., the increases are due to the Delta infection from people getting together after, before Thanksgiving. And so it's not Omicron yet. There are 30 states in the U.S. that do have Omicron, and I think the surge that we see with Christmas and New Year's in the U.S. will be based on Omicron rather than Delta. So we do urge everyone to get vaccinated, get boosted. But unfortunately, I think if people haven't been vaccinated yet, Omicron is not going to inspire them to get vaccinated. But we need to remember that even if it's not killing people, the more people are infected, the greater chance there is for new variants to emerge.
So, Kate, as Chris pointed out a moment ago, the Omicron variant was detected in South Africa just about a month ago. What have we learned about this variant so far from scientists in South Africa? I've seen some anecdotal information where scientists have been saying, look, what we have seen is very mild symptoms. In fact, the president of South Africa has been infected as well with the Omicron variant, and he says his symptoms are very mild.
A lot of the data or the information is still anecdotal, but the picture that's starting to form is that Omicron is more infectious than Delta, but it causes less severe disease. So that's reassuring. And we do know from some of the Pfizer studies, as was mentioned before, that there's less protection if you just have 2 doses of Pfizer or Moderna, but there's more protection if you have the booster. And we have other countries like Israel doing their own studies, releasing their own data. Also, Denmark in the EU is the country that's been sequencing more cases of COVID than others, and so they have more data on Delta and on Omicron.
Joseph Williams, right now, only 1 in 4 Americans has received a booster shot. 60% of the country actually have 2 shots in their arm. What is the administration, the Biden administration, doing to get more people to get these booster shots?
Well, they're trying to sound the alarm, but they're trying to be a little bit less hysterical than, less alarmist, let's say, than Boris Johnson in the United Kingdom. But what he's trying to do is get another push going on, because you've got various states that are trying to do different workarounds. In other words, in New York City, you've got a mask mandate that's returned. In Philadelphia, you have to do proof of identification of vaccination before you can enter an indoor restaurant. These are kind of popping up in different states to try to get people to understand that the vaccination rate is very, very important. But there's only so much the administration can do, because if they push too hard, they risk politicizing it again and turning off people who are already vaccine skeptics. And as we know, this is a pandemic of the unvaccinated right now. The people who aren't getting vaccinations are the ones who are most at risk either of getting the infection, dying from the infection, getting the new Omicron variant, and perhaps having some sort of replication of that particular strain becoming even more harmful than the one that we're dealing with right now. So basically, Biden is trying to thread a fine line between pushing really hard and not letting the situation take care of itself.
So, Judge, what do we know about the 59 confirmed cases of Omicron in the country?
Well, so far we don't know all that much. We're hearing anecdotal evidence that they are cases that have been broken through. They're breakthrough infections of people who had been vaccinated, unknown from my perspective before coming on air whether or not they were boosted or just had the 1 or 2 infections, but certainly the breakthrough infections are kind of worrisome in those cases. It is worrisome that it's made it to 30 states and not just on the brink of it, but the health officials in the United States kind of anticipated that it was going to come, so we're trying to get prepared for it by taking all necessary steps, but the Thanksgiving surge is complicating those efforts.
Kate, what are we to make of the fact that there are now 50 million people infected in the United States? That's 1 in 7.
Yeah, I mean, it's an important milestone. I think that probably by the end of this, most people in the U.S. will have gotten to COVID. And certainly I do expect the death toll to increase, including past the Christmas and New Year's. I think it speaks to the fatigue that people are under. Interestingly, South Korea recently announced that it was going to try to live with the virus, and it relaxed a lot of the restrictions. Of course, they then saw a spike, but I think we're seeing this desire to try to return to normal. And, people can return to normal activities as long as they do mask, do social distance, and do practice good hand hygiene, and of course are vaccinated and boosted.
Chris, we were talking earlier on about the new research that's been coming out of Israel. Israeli scientists believe that it was their aggressive campaign that got so many people to get the booster shot. I mean, could this kind of data be used as a selling point in other countries as well?
I think it already is, to be perfectly honest with you. Pfizer have published data. The UK Health Security Agency have also published preliminary findings on how well people are protected after they've been vaccinated. It's interesting the point that Kate just made, because she said, I think by the end of this, everyone in America would have actually probably had their day with this virus. I think by the end of this, everyone in the world will have done. They'll certainly have had enough of it, but I'm talking slightly flippantly. We're all going to catch this. Make no bones about this. We're all going to be exposed to this in the coming months to years. And that is the way it's going to be. And the whole question about living with the virus, this virus is going to sink into the background of circulating coronaviruses. There are 4 there already that cause the common cold. But when they first made their incursion into the human race, they produced extremely severe symptoms and they killed enormous numbers of people. Then they became entrenched and endemicized and started to spread just naturally through the population. This virus will be no different. But what we're doing at the moment is using vaccines to short-circuit the system and fool our bodies into thinking we've been seeing this throughout our lives as though we were catching it when we were little, so we have a trivial infection when we're older. And basically, that's the way it's going to have to be going forward. We will, for a while, have to intensify vaccination to keep the oldest, most vulnerable people protected. But in the meantime, we will slowly accumulate immune experience with this virus. And that means that for most people, it will cease to be a threat. It will be a trivial infection that you catch serially over a number of times in your lifetime, but it doesn't kill people. In the near term, we just have to try and keep pace with the vaccines to protect the most vulnerable while that process of natural evolution happens.
Okay, at this stage, I want to bring in now Dr. Alok Patel. He's a pediatric specialist and medical journalist based in San Francisco. Dr. Patel, great to see you. Thanks for being with us. In the United States, at least 35 states now reporting higher, their 7-day averages are now higher. What do you think are behind those increased numbers?
Well, I just want to echo what my astute colleague just mentioned here, is that those numbers are reflective of the fact that this is a more contagious virus. But it's important to note that we also don't have any data showing that it's more virulent or it's causing more severe disease. And I worry that some people here in the United States are losing sight of the fact that the Delta variant is actually still hospitalizing people and killing 700 to 1,000 Americans per day. And it's important that we still do everything that we've been doing in the past, and we pay attention to the fact that Omicron, if it is more contagious and it's able to outcompete Delta by some means, and it causes a less severe disease course, we'll take that. We absolutely would. And there's some headlines coming out right now that are kind of concerning, and people are talking about how, hey, Omicron might be able to produce these breakthrough infections, and it's causing a little bit of mistrust, and people saying, well, hey, I thought the vaccine works. And I think it's important to understand, again, as was mentioned, is we're all going to come in contact with this coronavirus. It doesn't matter what variant it is. And I am not personally concerned about a positive SARS-CoV-2 test. I'm concerned about SARS-CoV-2 turning into severe COVID-19. And the vaccines still prevent that process. And that's the message we need to be getting out.
Right, Dr. Patel, we were told that with the onset of winter, there would be more infections in the country. We've also just been through the Thanksgiving holiday. People were flying all over the country, meeting family. There were gatherings there. We've got the Christmas holiday coming up. So to what extent was the country prepared for this?
I think this definitely contributed. And we have to understand that we were prepared to the degree going into the winter, assuming a Delta surge. And we just happened to run into a variant that might be a little bit more contagious. Now, when we talk about preparation, we have been doing an aggressive campaign here with regards to vaccines and boosters. We're still being met with a lot of resistance and a lot of mistrust. And I think the United States is a complicated place in the sense that there are so many mini climates in terms of politics. And there's states who have said, we're going to live with this and we are going to keep everything open, let people get sick. We're going to build up that natural immunity. And other states are a little bit more conservative. And so it's hard to actually make an establishment about this nationwide preparedness. Whereas I will be able to say California was more prepared than some other states are. And, we're just sincerely hoping that this winter people take this seriously and realize that those who are not vaccinated, those who are vulnerable, those who are elderly, anyone who's immunocompromised is still at an increased risk. And that's something that we're trying to get ahead of. And, just because there's an increased case in Omicron infections, and we haven't seen that translate into severe hospitalizations or deaths, fortunately, it doesn't mean that it couldn't in 2 weeks, especially if people who are higher risk get infected.
Joseph Williams, the entire question of mandates, well, it's ended up in the courts in the country. We have a federal judge in the Southern District of Georgia. He has issued an injunction which bars the Biden administration from enforcing its COVID-19 mandate for employees of federal contractors. These are people doing work for the federal government. And then, of course, in New York, we have a very different situation where the Supreme Court has said that the mandate stands for workers there. I mean, why was there this pushback in the first place?
Again, because we looked at where the vaccines are going into people's arms and where the cases are happening, the fatalities are happening, and it's largely a phenomenon of states that did not vote for the president. Again, this vaccine handling has been politicized, even down to the Supreme Court, where even though the mask mandate was upheld in New York City, George Gorsuch wrote a dissent that focused on what a lot of people think about the difference between mask mandates and vaccine mandates and liberal and personal liberty, and that's the fact that they're saying that Justice Gorsuch wrote in his opinion that the powers that be that enacted this mandate were trampling all over religious liberty, that if people for religious reasons felt like they didn't want to go along with the vaccines or with the mask mandates, they shouldn't have to. And so that there is the dichotomy that we're dealing with in the United States, the fact that some people believe that science should prevail over ideology and other people simply don't. Never mind the fact that we also have a conflict ongoing that's fueling a lot of the dissent towards mandates, vaccines, and masks and otherwise, between science and misinformation and politicization and the common good. There are a lot of people who feel like they should not have to sacrifice for the common good because that detracts from the idea of America, which is individual liberty, even though we all know that these are health protocols that work. They work. Mask mandates work. Vaccine mandates work. And we've been living with this virus for 2 years, and everybody wants to put it behind us, but we can't until we all get on the same page about this.
Kate, from what we know right now, given that the vaccinations, including booster shots, have been successful at preventing people from getting sick and also people going into hospital as well. I mean, shouldn't the real measurement of how serious this pandemic is right now be determined by the number of people in hospital, by hospitalizations, rather than by number of people infected?
Well, it depends on how you look at it. Certainly on the issue of how many people are going to die or the burden on the health system, the hospitalizations is most important. But from a perspective of new variants emerging, number of infections is important, because the more people that have the virus, the more replications that occur, the greater the chance there will be a new variant. So both cases, both issues are risky. High hospitalizations are risky, but also high numbers of cases are risky as well.
And Kate, it still is the case that most of the people who are in the hospital right now are unvaccinated.
Yes, in the U.S., where Delta is still prevailing, most of the people hospitalized are unvaccinated. But what we're seeing in the U.K. is those vaccinated with Omicron have been, those hospitalized with Omicron have been vaccinated but were not boosted. And I expect to see the same after Christmas and New Year's in the U.S.
Alok, Patel, there are reports from South Africa that young children are now getting sick with the Omicron variant. What do you know about this?
Well, what we've heard anecdotally from our colleagues in South Africa is exactly what you mentioned, is that a lot of young people have gotten kind of infected with Omicron. They're seeing more severe symptoms than what we've seen over here. Now, I don't know if that's because they didn't have access to vaccines in the way over in the United States, where we've had over 5 million children from the age of 5 to 11 get at least a shot a vaccine. So I don't know if it's based on that. I also it's hard to tell if this is because it was a super spreader event or if there were sincerely breakthrough infections. So it's hard to really tease that out. But fortunately, we haven't heard of any deaths in this age group, which is important to understand. I also think it's important that we don't make a conjecture and saying like, hey, there's acute cases, people are recovering while they're young and healthy and don't have underlying medical conditions. We can't make an assumption about that population and say that it's just going to hold true if people who are higher risk get infected as well. But all of that is early preliminary data. It is reassuring to know that. I also think it's important to understand exactly what we just heard, that the boosters are preventing those more severe illnesses, at least in early data. And I hope that message just fires across on every cylinder in the United States, where there's still a lot of resistance towards getting a booster. Or I shouldn't even say booster anymore. I should say the third shot in what will probably become a 3-dose series.
Yeah, and there's still a lot of resistance to people getting vaccinated at all. Chris Smith, what is the relationship between the emergence of new variants ahead and the number of people who are not vaccinated?
Indeed, if I may pick up on the point that Alok just made,
yeah.
In South Africa, where we've seen, yes, young children with this, the key word is with. And when I spoke to researchers in South Africa last week, they told me that, in fact, when they've looked into the data, while there were diagnoses in young children, a lot of those are children who come in with another problem and are picked up also with Omicron on top. So it wasn't that took them to hospital, it was something else, and they were infected incidentally. So that's an important question. It doesn't mean that it's causing them to be in hospital. Very important to make that distinction.
Right.
The children remain at very low risk. In terms of numbers and variants, this is an important issue too, because at the time that this new variant emerged in southern Africa, we think probably in Botswana, probably in August, actually the number of cases that were being declared in southern Africa could be measured in a matter of hundreds per day of actual total coronavirus infections. That is in contrast to, at the moment, the United Kingdom has between 50 and 60,000 cases per day that we know about. You can probably comfortably double that. So you can see that actually emergence of variants is not just a function of numbers of diseases. You're right, Kate, that the more disease there is, the more virus rolling the dice there is, the more chances there will be for virus variants to emerge. But it's not a given that just because there's lots of virus in one place, you will get the variant there. Yes, it's happened in that way in the past, but it's also now happened in southern Africa where there were very few cases per day. It really does come down to probably other factors and possibly things like the coexistence of diseases like HIV and other immune disabling disorders that encourage the virus to adapt and change within an individual. And that's what we think may have happened in the context of this South African variant that we're calling Omicron.
Kate, when we were looking at the figures today, I mean, there was one figure that really stood out, and that is that there is no single group in the United States that have suffered more from the pandemic than seniors. In fact, more than 2/3 of the people in the US who have died from COVID have been 65 years or older.
Yes, it's really, in a way, a societal change. We've lost an incredible generation, and people who don't seem willing to be vaccinated don't seem to be willing to protect our seniors. Now, as we go into the Christmas season, we'll definitely need to have a lot more measures in place in nursing homes and assisted living centers to protect them, make sure that the employees there are vaccinated. But it's a very interesting study in societal values and what's going on in the U.S.
And have we seen numbers going up? You talked about other measures having to be put in place. Kate, do you see under any circumstances where we could see another lockdown?
In the U.S., on a national basis, certainly not. And I don't even expect at the state level. I think you will see moves like New York City requiring a booster for indoor dining. But I think people will be able to do their regular activities, as long as they're masked. But I don't expect lockdowns in the U.S. I think it's also important to note the impact that Omicron has had on international travel, whether for business or for vacation. I actually just recently took my first international business trip since COVID, and it's much more difficult, finding a lab that can, give you a test within 24 hours. And even passing through London, I needed to get a special certificate just to pass through the airport. It now is orders of magnitude more difficult to travel internationally.
So, Chris, in the United Kingdom, the Prime Minister is urging booster shots right now. What could we see in the weeks ahead, in the days ahead, really?
Well, the ambitious target is to be shooting up 1 million people per day, the aim being that by the new year, the turn of 2022, all eligible adults will have been boosted. And the rationale for that is that although the virus has changed, Omicron is a bit different, the appearance is slightly different, that means the immune system might find it's more a slippery target, more likely to slip through its fingers. If you basically deluge the virus in a huge amount of antibody, you're basically substituting quantity over quality. You can effectively still rein it in. So that's the idea. Give people boosters, drive up immunity, rein in the virus, keep levels to a low level. Hopefully, in the meantime, we'll see that, in fact, the degree of clinical severity, especially in the context of an already heavily vaccinated population, will be low. And as a result, we'll go into 2022 with measures in place that will actually help us against Delta, that remains at the moment the lion's share of the cases and the biggest threat.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thank you for watching.